This segment will introduce diethylene triamine pentaacetic acid, or DTPA, and discuss its indications, administration, adverse effects, and special considerations. Afterwards, there is the option to apply what you have learned within a case study. Dtpa is a chelating agent used for radioactive plutonium, americium, and curium. When bound to these radionuclides, Dtpa accelerates renal elimination from the body in urine and effectively reduces the duration of radiation exposure the body receives. It is important to note that Dtpa does not repair or protect the body from radiation damage and is only effective for the specific radionuclides mentioned. To illustrate this fact, Dtpa treatment may actually increase the deposition of uranium and neptunium into bone and is therefore not recommended treatment for contamination with these radionuclides. There are two available forms of Dtpa used to treat internal contamination: calcium Dtpa and zinc Dtpa. Both are considered effective forms of treatment, but as will be discussed later, there are specific times when one form is preferred over the other. If authorities determine it to be appropriate for a radiation emergency, the distribution of Dtpa from state and federal stockpiles will be managed by public health agencies and will then be administered by medical personnel. Use of Dtpa is indicated when individuals have been internally contaminated with a significant dose of radioactive plutonium, americium, and/or curium. When there is clinical suspicion of internal contamination, an exposure evaluation will be necessary to determine the amount of internal contamination and corresponding radiation dose. Clinical decision guides, or CDGs, can also help determine when Dtpa is indicated. CDGs are discussed in another section of this training module. Starting treatment as close to the time of exposure as possible is ideal. However, even in situations where Dtpa is not immediately available, it will still be helpful and should be provided when available. Calcium Dtpa and zinc Dtpa are used differently depending on when treatment is started and how long it lasts. Calcium Dtpa is considered more effective in the first 24 hours, but carries higher risk of mineral depletion from the body if multiple doses are given over a long duration. However, more than 24 hours after exposure, zinc Dtpa is considered as effective as calcium Dtpa and carries less long-term risk of mineral depletion. In the event that zinc Dtpa is not available, long-term treatment with calcium Dtpa is still indicated but should be given with a multivitamin supplement. Also, monitoring for mineral depletion, particularly zinc, magnesium, and manganese, should occur. Both adults and children can receive either form of Dtpa, but whenever possible, pregnant women should be provided only zinc Dtpa. In the absence of zinc Dtpa, it is better to treat with calcium Dtpa and a mineral supplement than to withhold treatment. Dtpa can be administered intravenously or by nebulizer. Regardless of route, Dtpa should be given as a single dose once daily. This chart provides detailed information regarding dose and treatment. For adults receiving either calcium Dtpa or zinc Dtpa intravenously, 1 gram of Dtpa solution, available as a single vial with a volume of 5 milliliters, can be administered via slow IV push over 3 to 4 minutes. Or, 1 gram of Dtpa solution can be diluted in 100 to 250 milliliters of 5% dextrose in water, Ringer's lactate, or normal saline and administered over 30 minutes. For adults receiving nebulized calcium Dtpa or zinc Dtpa, 1 gram of Dtpa solution can be diluted 1-to-1 with 5 milliliters of sterile water or normal saline and inhaled over 15 to 20 minutes. For children, safety has only been established for IV administration of calcium and zinc Dtpa, and dose is calculated based on the child's weight. When administered to children intravenously, 14 milligrams per kilogram per day, not to exceed 1 gram per day, of calcium Dtpa or zinc Dtpa can be administered via slow IV push over 3 to 4 minutes. Or 14 milligrams per kilogram per day, not to exceed 1 gram per day, of calcium Dtpa or zinc Dtpa can be diluted in 100 to 250 milliliters of 5% dextrose in water, Ringer's lactate, or normal saline, and administered over 30 minutes. When possible, obtain baseline blood and urine samples, including CBC with differential, serum electrolytes and renal function, urinalysis, and blood and urine radiobioassays before initiating treatment. Since radionuclides chelated by DTPA are eliminated in urine, treatment should be given cautiously in patients with impaired renal function. During the course of treatment, samples of blood, urine, or feces may be collected to establish the effectiveness of treatment and/or the amount of radioactivity present. Testing for residual internal contamination should occur on a regular basis to determine when treatment can be terminated. Individuals that receive DTPA should also be monitored for allergic and other adverse reactions. The main adverse effects of DTPA use include the depletion of certain essential minerals, especially with calcium DTPA. Patients may also experience nausea, vomiting, chills, diarrhea, fever, pruritus, and muscle cramps. For patients receiving nebulized DTPA, breathing difficulties may also occur. There are no known contraindications for DTPA treatment. Calcium DTPA should be used cautiously in children, pregnant women, or in patients that have kidney disease or hemochromatosis. Nebulized DTPA treatment may be associated with exacerbations of asthma, so care should be taken when treating patients with a history of asthma. Some reminders. Pregnant women should be given zinc DTPA where possible, and extended treatment with calcium DTPA should be given with accompanying vitamin supplement to address potential mineral depletion.